Nexus Mundi has embarked on a great and inspiring journey in unison with world-class institutions, the Jesuits, Telecom Italia, Columbia University Institute for Teleinformation, and University of California, Davis, working together to bring to poor, rural, and unserved communities the breakthroughs in the application of science, medicine, computing, and telecommunications that will make our countries and the world a better place. At Nexus Mundi, we believe in one world. One heart, one world.
80% of the global burden of cardiovascular diseases are in developing countries, which includes sub-Saharan Africa, where we are. So if you look at 80% of the global burden being in sub-Saharan Africa, it means that by 2020 or 2030 thereabout, the commonest cause of admission, the commonest cause of death among the people who live in this part of the world will be the non-communicable diseases, out of which cardiovascular diseases and cancers will be the leading cause.
And the challenges are very vast distances, as well as having a very sparse population.
They have to travel to see the doctor and nurse for hours a day.
Our patients are having to walk long distances to get to the nearest health facilities because we don't have as much transport as we have in the urban areas. So people walk. We don't have as many qualified or experts or specialized doctors working in our facilities.
There has been a lot of attempts to try and have equity of access of quality health care, so that especially the mother and child, we can reduce the high mortality and in children and mothers. There are two things which telemedicine can provide. One is to ensure that the healthcare deliverers who are already in very short supply are connected with the services which are being offered in the major institutions. The other thing is that there will be instances when they really don't know what to, they are not experienced enough to deal with the cases they find. How nice it could be if you had telemedicine where you can sit there in your health center, in your rural hospital, and be able to talk and provide the services.
So Telecom is really motivated to join this project in Zambia as well as in other developing countries. Those projects can change radically four things. The first is the capability for diagnosis and healthcare. The second is the possibility to provide local medical centers with specialist counseling. The third is the possibility to train the doctors. And the fourth, of course, is to help those countries in gathering data and in structuring processes. For those projects to succeed, there are four important needs. The first is the network availability. The second is sensors availability. The third is medical centers. And the fourth is cloud. So Telecom Italia can provide three of those four items. I think that, of course, the availability of technology is an important success factor of the project, but I think that the most important one is the real capability to put together all the essential players. So technology players, institutions, and even people that know very well those environments.
I think that this project could change the situation in Zambia by increasing the sensibility to the screening of cardiovascular disease, to the prevention, to the treatment, to the finding of high-risk patients.
Using mobile devices, they can provide a clinical assessment at a local clinic. Zambians can have access to sustainable and quality health services.
Ayambala baguli taguli muzamundira kubuya nene ubuwe ndagulya muzamu kubuwe Ayambala baguli taguli muzamutula kubuya kapa ubuwe buwenda kulya musamugo buwe